Namaskar. This is Dr. Alok Roy from Medica, Kolkata. Like every week, this Saturday we are here with you between 5:30 to 6:30 on a webinar under the banner of Health is the Ultimate Wealth. We are supported by Bengal Chamber of Commerce and Industry and Rotary Club of Calcutta, Vienna. We are very grateful to them for taking our messages to the people so more people can stay healthy. Last week, we talked about the re-emergence of COVID, and there was a tremendous response from all of you. You all responded, you all listened to us, you all followed. I hope that you are being careful. We are still in the midst of fourth wave. Please take your vaccination if you have not taken booster dose and stay healthy. But we are also in the midst of monsoon. And how can monsoon affect our liver and our gut? To deal with it, I have with me Dr. P.K.Sethy, who is our senior consultant gastroenterology, director of gastroenterology, and a very renowned gastrophysician. Without wasting any time, I would request Dr. Sethy to talk about his topic and his deliberations on monsoon, its ill effects on liver and gut. Dr. Sethy, over to you.
Thank you, sir. Thank you for the kind introduction, and thank you for this great initiative for our patients, for our general public. They are really benefiting. Today, I'll speak on monsoon and GI and liver diseases. At the present time, this is very relevant. We have rainfalls intermittently. We have humid atmosphere, temperature variation, and we are seeing more number of GI and liver disease patients. So next couple of minutes, like 15-20 minutes, I will speak on monsoon, what is the importance. GI diseases and liver diseases we see more frequently during monsoon, and what to do. So the term of monsoon was first used in English in British India and neighboring countries to refer the big seasonal wind blowing from Bay of Bengal and Arabian Sea in the southwest, bringing heavy rainfall to the area. So this was described long back as monsoon. So some interesting fact about monsoon. There are nearly 5 lakh lightning strikes during monsoon. The name monsoon is believed to be derived from an Arabic word, monsoon, meaning weather. Arizona receives 31% total rainfall during monsoon. In several parts of the world, including India, life depends on monsoon. So basically, we all depend on the monsoon rainfall, and monsoon is very important part of life. Of course, monsoon is beautiful. You can see these two pictures. One is beautiful picture of monsoon. Second is a waterlogged road with yellow taxi of Kolkata. So how monsoon changes the plot? What happens? There is a change in temperature, even variation in temperature, more humidity, more growth of and survival of germs that includes viruses, bacteria, protozoa, all types of bugs. Also more contamination because of the rain and because of humidity. And there is a transmission of all germs through the food, air, water, hands, flies, mosquitoes. So we see more number of diseases which are transmitted by this food, air, and mosquitoes, starting from fever to jaundice and different types of other infective diseases. So we always see an increase in number of patients with stomach, bowel, and liver infections during the rainy season. But fortunately, they are not fatal. There is no death, but people do suffer. There is increase in OPD visits, there is increase in IP admissions, and there is increase in cost to it. We do have a defense system working in our body to take care of them, but if there is overexposure of unwanted elements from the environment, that cause some health complications. So even if you know airways and our intestinal systems like nose and oral cavity are doors to the environment. So there is more exposure for any unwanted elements, be it bugs, be it abnormal amount of pollution, then there is a disease. In rainy season, there is a rise in common diseases that includes most of the infectious diseases starting from cholera, typhoid, all the viral fevers, diarrhea, mostly acute gastroenteritis, common cold, flu, dengue, chikungunya, malaria. So you can see a good number of infectious diseases rise in the rainy season. So how to avoid them and how to manage them? Starting with food poisoning. While viruses are behind the majority of GI infections, but bacterial infections are also very common. This bacterial infection causing this vomiting and loose motion is called food poisoning. Whenever there is a contamination of food with this type of bacteria, then we have illness. And the major causes are many, like starting from Yersinia, which is found in pork. If you take contaminated pork with Yersinia, Staphylococcus, which is found in dairy milk, like like meat and eggs, can cause food poisoning. Shigella found in water, mainly swimming pools, and Salmonella, which is found in meat, eggs, and dairy products. Campylobacter, E. coli, all these are found in our food, and we can get infected with this contaminated food. So coming to diarrhea, how to define diarrhea? If there is multiple loose motions, mainly watery, possibly more frequent bowel movements, then we define a diarrhea. And they need treatment depending on the cause of diarrhea and duration of diarrhea. And this during the monsoon, these diarrheas are morely acute, that is short duration diarrhea and infective. So there are two components for the treatment of acute diarrhea. One is hydration, that is enough liquids orally, and you can take ORS depending on the dehydration part. And more often during this monsoon diarrhea, we use antibiotics. So how to prevent infective diarrhea? Frequent hand washing so that you should not infect yourself from the contamination or you should not infect others. Also eating healthy and fresh food. Then because we see quite good number of patients with diarrhea in OPD also, and in every family will have many patients during this season with diarrhea. So when should you visit a hospital, or even when should you get admitted? If the diarrhea persists beyond 2 days, if there is no improvement in diarrhea in 2 days, or you become very dehydrated, that is you are passing less urine, your tongue is dry, you are feeling giddy, and you have severe pain abdomen or rectal pain, that means you need admission and for the treatment of diarrhea and other symptoms. Anytime you are having bloody or black stool, then we call it dysentery. And that time, that means your diarrhea is very severe and there is blood oozing from the colonic colon. So you need specialized treatment. So if you are having fever which is more than 102, or the fever is persisting for more than 2 days, then also you need admission. These are a couple of criteria for the hospital visit and admission. Then coming to the disease specific, I will just discuss a couple of diseases which are more common and which most of people know about this, like typhoid. Most of people know about typhoid. It's a continuous fever and this ill feeling, tiredness, weakness, and in association you have pain abdomen. And we do a couple of blood tests, including Widal and some antigen test, and diagnose of typhoid fever. And the fever may persist for a couple of days to weeks, and sometimes can be dangerous if there is a blood in the stool, because we know this typhoid can cause ulceration in the intestine and can cause GI bleeding, and it's very difficult to manage. Sometimes can lead to serious emergencies, but most of time it can be treated with antibiotic for proper duration. Then how to prevent typhoid? Most important is food safety, because we know this is spread to the food matter only. From whatever we eat, the bacteria comes to the intestine. Water safety, avoid outdoor foods, and during public water difficulties like there is contamination of public water, then we see number of patients of typhoid and gastroenteritis in the community. Typhoid vaccine is available. One should take typhoid vaccine to prevent the disease, and most of time this is really helpful. Now coming to cholera. Cholera is commonly known as rice water stools. It's very rare nowadays because of better hygiene in India. But there was a time, couple of decades back, there are lots of mortality. Even in the family, 50%, 30% will die of cholera. Fortunately, because of better management, because of better hydration, we are now getting rid of cholera. Only few case reports are reported nowadays. Few numbers of patients are very less, but can be dangerous due to heavy water loss. And we have vaccines for cholera. We can take a couple of cholera dose vaccines and get rid of this disease. Then what not to do during monsoon to prevent disease? Try to avoid eating seafood as the weather gets contaminated. Food gets contaminated during monsoon, and eating seafish can be dangerous and can cause diarrhea or cholera. Don't eat hot foods. At least those foods which are exposed for quite some time, mainly roadside, they can be contaminated with the bacteria. Avoid taking green leafy vegetables. And whenever you want to take vegetables, green leafy vegetables, try to boil it or wash it properly, because that can also spread the bacteria and cause GI infection. Then what to do during this monsoon to prevent GI diseases? It's you can take lot of probiotic like yogurt, buttermilk, and that will give some immunity to the GI system and support your GI system. Take enough water to flush the toxins of the body, and it can prevent dehydration. And whenever you are taking some vegetables, during this time, try to take steamed or boiled vegetables so that the bacteria dies, and try to take the fresh vegetables if possible. Then coming to liver diseases. We all know about liver diseases. They are mainly either acute liver disease, which is transient, which improves by its own with some treatment which is supportive, and patient gets cured. But some diseases which can lead to liver cirrhosis, that is, those are chronic diseases. Fortunately, during this monsoon, we get mainly acute liver diseases, mainly jaundice because of the infection. So there are three common conditions which we see during this monsoon. One is acute hepatitis A, acute hepatitis E, and leptospira. So all these three, they can cause mild prodrome like low-grade fever, loss of appetite, fatigue, and finally jaundice. Leptospira, the fever continues, and in acute hepatitis A and E, fever subsides with jaundice. Liver infections or hepatitis, that is liver inflammation, can reach epidemic proportion during monsoon, mostly caused by A and E virus. And you are most likely to get hepatitis A or E if you take contaminated food or water from close contacts with a person or objects that is infected. That is, if somebody is infected or the food is infected, you take the food, then you are likely to get hepatitis A or E. Then coming to leptospira. Leptospira is another condition which is a bacterial infection. Mainly this spreads from the animal. It spreads through the urine, especially the dogs, rodents, and farm animals. They may not have any symptoms, but they are the carriers. So from these animals, we get the infection, by the spread of the urine to the contaminated water or food material. The symptoms are mainly headache, muscle pain, jaundice, that is yellowing of the skin and eyes, vomiting and diarrhea. And treatment is mainly antibacterial. Most of the patients, they improve with antibiotics. Now coming to hepatitis, both A and E, they are acute viral infections. Both are spread by food and water. Rest of the two viruses like B and C, they are not waterborne disease, they are spread by blood products or intravenous blood products. So A and E are more common in this type of epidemics and this type of seasonal variation. As I told you, we start with fatigue, itching, loss of appetite, low-grade fever, nausea, vomiting, and we have after a couple of days, we notice there is a dark urine. Then only see a doctor, do some blood test, finally you diagnose as acute hepatitis. Most of time, 99.9, maybe 99.5 or 9%, patients improve with medications, with supportive care. Only a minor fraction, they can develop acute liver failure. And sometimes you need a liver transplantation during even this acute liver failure, which is very difficult. The treatment of hepatitis C is mainly rest, and when the symptoms are more severe, you have to take rest, otherwise supportive care, hospitalization whenever required, and most patients improve. How to prevent hepatitis A and E? Again, emphasizing on hand washing for all these infectious diseases. Be careful not to eat unwashed food. Be careful not to drink unclean water. And out of this A and E virus, we have hepatitis A vaccine, which is very effective. And those who have not taken vaccine in any age can take hepatitis A vaccine to prevent the disease. And if somebody is not infected with hepatitis A in the childhood or even during the late life, then if he gets infected in the like in the elderly age, then the management becomes very difficult because the complications are much more like chickenpox. So when to hospitalize in case of jaundice, because most of the patients with jaundice, those who are because of liver inflammation, that's hepatitis, can be managed at home. So only a few percentage they need to come to the hospital. So how to decide whether somebody needs hospitalization or not? When somebody is not able to take orally, that is vomiting, or somebody is not able to take enough diet orally, or somebody is having complication, that is bleeding, altered sensorium, like somebody is drowsy, not speaking properly, or low urine output, not passing enough urine, ongoing fever, or significant pain abdomen, then only we hospitalize. And most of the treatment depends on the complication. We usually manage the complication and give time to liver to improve. As I told you, most of the patients do improve with the management, except a few minor fraction can go for liver transplantation because of acute liver failure. So certain facts and myths about the food in case of jaundice, that is acute hepatitis. Mostly, there are lots of myths about the food. Even yesterday, I visited when I was taking rounds. I was talking to one of the patients who had jaundice. He's fine, he's going home, and the relatives, they are not allowing him to take any food item, like any spicy or only boiled food for last 1 month. So even if you tell repeatedly, give them normal food, that nothing going to happen, then it's mostly the food is decided by the family members. Whatever you decide, whatever you explain them. So I will emphasize that good diet is most important. If the patient is not able to take or vomiting, start IV fluid in the hospital. And there is no question, there is no issue of yellow foods. One can take yellow food, one can take little bit of oil or fat, because if you don't give sufficient nutrition, somebody is not liking the food. Jaundice is going to stay for a month before totally comes to normal. So you cannot avoid nutrition for a month. And at the same time, there should be no alcohol during this jaundice period at least. Thank you very much. Thank you for your kind attention.
Thank you, Dr. सेठी. आप सब हमसे सहमत होंगे कि डॉक्टर सेठी ने बहुत अच्छी तरह से प्रेजेंट किया. इन्होंने कहा कि जो है मॉनसून के इल इफेक्ट्स क्या होते हैं. उन्होंने कहा कि स्टमक नॉर्मली, बाल एंड लिवर इन्फेक्शंस आर कॉमन इन मॉनसून. इन्होंने कहा कि जैसे हम लोग का मुंह और नाक जो है ये एनवायरनमेंट के टच में रहता है, उसी तरह इंटेस्टाइन भी हमारे एनवायरनमेंट के एक फर्स्ट interaction happens with the world, with the environment of intestine as well. तो इन्होंने कहा कि ज्यादातर बीमारियां होती हैं मॉनसून में खाने से, हवा से, पानी से, हाथ से, मक्खियों से और मच्छर से. These are the carriers of infection. Food, air, water, hands, flies and mosquitoes. तो ये जो नई नई चीजें, मॉनसून में फ्लाइज बहुत आ जाती हैं, पानी में बहुत कंटामिनेशन हो जाता है, पानी सीवर वाटर से मिल जाता है, तो ये सब चीजें जो है बीमारियां लाती हैं, ये बीमारियां के रास्ते हैं. और हमारा जो इंटेस्टाइन है, बीइंग ए डोर टू द एनवायरनमेंट, ये एनवायरनमेंट का रास्ता है, इसके रास्ते से बीमारियां हमारे लिवर और गट तक पहुंच जाती हैं. डॉक्टर सेठी ने ये भी कहा, he also said कि ज्यादातर गैस्ट्रोइंटेस्टाइनल इन्फेक्शंस आर वायरल, दो देयर आर बैक्टीरियल आल्सो, बट मोस्टली वायरल. तो डॉक्टर साहब, वी विल लाइक टू नो हाउ विल अ कॉमन मैन डिफरेंशिएट बिटवीन अ वायरल एंड बैक्टीरियल इन्फेक्शन, एंड व्हाट इज ट्रीटमेंट स्ट्रेटजी फॉर बोथ? आर दे सेम और आर दे डिफरेंट?
Sir, it's very difficult for a common man, even for a doctor, to understand the viral infection or a bacterial infection. But there are very soft pointers. लाइक किसी को अगर बुखार कंटिन्यू कर रहा है, बुखार कम नहीं हो रहा है एंड सिम्टम्स कम नहीं हो रहा है, यूजुअली वायरल इलनेस काफी बार अपना मैक्सिमम टाइम अपना आप ठीक हो जाता है. सो यूजुअली क्या था, हम जो अडल्ट में देखते हैं, बट अडल्ट एंड पेडियाट्रिक्स इन्होंने थोड़ा डिफरेंट है. इन केस ऑफ पेडियाट्रिक्स वी सी मोर ऑफ viral illnesses like viral gastroenteritis, viral, but in adult we don't see so much of viral illness in GI infections. It's mostly bacterial. So because nowadays nobody, even for you or for me, nobody wants to waste a day for also in falling sick for a small diarrhea or even common cold. So everybody wants to get improved fast as possible. So many times even we try to treat more and to get improvement so that we can treat the patient and improve the patient faster. So we have to think in that way. Sometimes what I feel, for adult patient, we start antibiotic more often rather than waiting for the illness to subside.
So आप कह रहे हैं कि कॉमन मैन के लिए डिफरेंशिएट करना वायरल और बैक्टीरियल में अंतर है, मुश्किल है थोड़ा सा, और वायरल अपने आप ठीक हो जाता है चाहे दवा दे ना दे, लेकिन बैक्टीरियल में दवा देना पड़ता है, और मोस्टली बच्चों में वायरल होता है, एडल्ट्स में बैक्टीरियल हो सकता है. इसलिए एडल्ट्स में आप लोग जल्दी एंटीबायोटिक देते हैं, बच्चों में जो है थोड़ा वेट कर लेते हैं, ये आप कह रहे हैं?
यस सर. दूसरा बात, मैं और एक बात बताऊंगा सर. ये क्या होता है कि अगर आपका फर्स्ट एपिसोड ठीक टाइम पे इफेक्टिव ट्रीटमेंट नहीं हुआ, काफी बार पेशेंट आता है, कोई मेडिसिन नहीं लेते हैं, हो सकता है ठीक हो जाएगा, एंड यूजुअली वो कोर्स प्रोलॉन्ग होता है, कुछ 10 दिन 15 दिन थोड़ा दर्द होता है, थोड़ा ना कुछ समस्या रहता है, एंड अल्टीमेटली इनको इरिटेबल बाउल सिंड्रोम एक लॉन्ग टर्म में सिम्टम रह जाता है. सो जिसका ट्रीटमेंट अगर इफेक्टिवली शुरू हो, पहले 5-6 दिन अगर प्रॉपर ट्रीटमेंट ले लें, तो उनका पोस्ट जो इन्फेक्शन एपिसोड थोड़ा बेटर रहता है.
So you are saying that they should consult doctor early to recover early, and also post-infection syndrome will become less.
Yes.
Good, very good. Now, I was told that bacterial infections are in. मान किसी को bacterial infection से diarrhea है, तो उसको जो है पेन ज्यादा होता है, और जो वायरल है उसको मोशन ज्यादा होता है, नंबर ऑफ मोशन ज्यादा होता है. Is it true or it's wrong?
It's very difficult. It's very subjective, sir. Sometimes it's very really difficult to know. And इनके इवन वायरल एपिसोड में भी सर काफी डायरिया होता है कि जिससे हमको हाइड्रेशन करना पड़ता है. इवन आप देखेंगे मैंने काफी बार ऐसा होता है कि हम एंटीबॉडी ना दें बट एटलीस्ट हाइड्रेशन मेंटेन करना पड़ता है, इसलिए काफी आईवी फ्लूइड देना पड़ता है. So it's very difficult to really understand.
Correct. Okay. Also, few things you pointed out. When diarrhea becomes a dysentery, where the normal diarrhea becomes a dysentery, where and आपने कहा कि dysentery means the blood is tinged with the stool. Now, how does it happen?
Yes. So that means that you have a severe diarrheal episode and the bacterial infection is so severe that there is some ulceration in the intestine. Because without ulceration, you will not have blood in the stool. That means there is a involvement of rectum or left colon because of the bacteria causing dysentery. So there is no doubt, but this is the common scenario. But sometimes for a gastroenterologist, anybody having blood in the stool during diarrhea, we think of something called ulcerative colitis. And many times, this can be the first episode of ulcerative colitis. So you never know whether you have an ulcerative colitis or infective colitis. Only time will tell, and you need a supervised follow-up for the episode. So somebody having blood with diarrhea should not be neglected, should have a 1 or 2 months of follow-up, whether a persisting blood in the stool or you have totally subsided blood and the blood is subsided.
So Dr. Sethy is saying that blood in the stool is a very ominous sign. It is not a good sign. And is it because of infection or because of ulcerative colitis? That's another disease altogether. To differentiate, you need to follow up with the doctor for 3 to 4 months. So if ever you have a diarrhea, which becomes a bloody diarrhea, that needs a very careful attention of a gastroenterologist. That's what he is trying to say. Doctor Sahab, आपने एक बड़ी interesting बात कही, which reminded me of when I got married 38 years back. My father-in-law used to tell me that don't eat fish in a month which does not have R. So May, June, July, August, and this is exactly what you said, that don't eat fish, especially seafood, in monsoon because they're likely to get infected. So old wisdom, it still stands true, and the modern science is just proving it. So he has said very clearly that monsoon may seafood especially avoid kariye because that could be contaminated. इन्होंने ये भी कहा डॉक्टर साहब ने कि लिवर में पानी से, खाने से और आदमियों के द्वारा हेपेटाइटिस होती है, A and E. 4-5 तरह की भी हेपेटाइटिस है, लेकिन जो वाटर बोर्न है, जो फूड बोर्न है, वो A and E. उन्होंने कहा कि दोनों जो है बहुत ही खतरनाक है, बच के रहिए. और सबसे बड़ी बात डॉक्टर साहब ने ये बताई कि इन दोनों की वैक्सीन, टाइफॉइड के लिए उन्होंने कहा वैक्सीन रिकमेंड किया और कहा हेपेटाइटिस ए के लिए वैक्सीन. I would like to tell my listeners that take your vaccines seriously. Vaccines are truly meant to be preventive. And hepatitis A vaccine, इन्होंने ये डॉक्टर साहब ने ये भी कहा कि बच्चों में जिनको हेपेटाइटिस ए होता है उनका इलाज करना आसान होता है, लेकिन बड़े उम्रदार के लोगों में जो लोग not so young, if they get hepatitis A, then it becomes very difficult to manage. It is a difficult task to manage in them as compared to children and young adults. And it can be prevented by hepatitis A vaccine. So, Dr. साहब, ये hepatitis A vaccine कितनी महंगी आती है और कितनी बार लेना पड़ता है?
2 बार ही लेना पड़ता है सर, 2 बार only लेना पड़ता है, and very cost effective, very cheap, and you can prevent one disease altogether throughout life because you have sufficient antibody. अगर काफी बार क्या होता है कि लोग पूछते हैं सर हमको तो जॉन्डिस हुआ है, दैट टाइम्स आइदर कैन टेक ए वैक्सीन, देयर इज नो हार्म। काफी बार लोग पूछते हैं कि अगर हम हेपेटाइटिस ए हुआ तो लेने से क्या दिक्कत होगा, पर हेपेटाइटिस ए हुआ तो काफी बार हम कहते हैं एंटीबॉडी टाइटर करके भी देख लेते हैं, पर एंटीबॉडी नहीं हुआ होगा तो दिस है लाइफ लॉन्ग इम्यूनिटी। एक बार कोविड जैसा नहीं है, आपको बार बार लेना पड़ता है, एक बार आप वैक्सीन कंप्लीट कर दिए तो लाइफ लॉन्ग आपका इम्यूनिटी रहेगा।
डॉक्टर साहब आपने कोविड से क्यों कंपेयर किया? कोविड में तो बहुत से लोग हमारे यहाँ भर्ती हो रहे हैं, जो भी हमारे यहाँ भर्ती हो रहा है, उसमें तो बहुतों ने जो है बूस्टर डोज लिए ही नहीं है। 2 के बाद जब सरकार ने कहा कि 9 महीने बाद बूस्टर डोज ले रही है, नहीं ले रहे हैं, अभी भी बहुत कम लोग ले रहे हैं। तो बूस्टर से तो कंपेयर नहीं करें, कोविड से तो अच्छा है।
लोगों का कोविड के साथ मिसकंसेप्शन है, दे कंपेयर विद एवरीथिंग। तो उनको लगता है कि भाई ये कोविड के वैक्सीन तो गवर्नमेंट ने बोला ले जा रहे हैं, 3 बार 4 बार 5 बार लेना पड़ेगा, ऐसे आपको भी हेपेटाइटिस बी का एक लेना पड़ेगा, ऐसे नहीं है, डिफरेंट है।
एंड जिसको पहले जॉन्डिस हो चुकी है लेकिन तो वो भी ले सकता है क्या हेपेटाइटिस ए की वैक्सीन?
सर हेपेटाइटिस ए का वैक्सीन सब लोग ले सकते हैं, अगर आप ऐसे ही अगर किसी को हेपेटाइटिस ए का टाइटर करना पड़ेगा ले सकते हैं, बट मोस्टली जो होता है ना ए और ई होता है जो कि सेल्फ लिमिटिंग है, एंड अनफॉर्चुनेटली ई का वैक्सीन हमारे पास है नहीं, बट ए का वैक्सीन जरूर लेना चाहिए।
चलिए, मैंने कभी नहीं लिया, मुझे कभी जॉन्डिस भी नहीं हुआ, आज ही लेता हूँ।
हेपेटाइटिस ए हुआ होगा
नहीं हुआ, कभी जॉन्डिस नहीं हुआ। चलिए, गुड। सो आप सब हमसे सहमत होंगे, यू ऑल विल एग्री that Dr. P.K.Sethy has very well explained some of the maladies, and he has mentioned very clearly that it is just prevent. It's an infective time when because of high humidity and air and water being contaminated with the humidity and with the contaminated water, it spreads through food, air, water, hands, flies, and mosquitoes, as we said earlier, and we get viral and bacterial infection. Prevention is easy and simple, and even he mentioned about the some of the vaccines. So let's stay healthy. Let's these small tips will keep you going healthily in your life in all your pursuits. Stay healthy. Have a nice weekend. Thanks to Dr. P.K.Sethy and all of you who have joined us. And I'm again grateful to Bengal Chamber of Commerce and Industry and Rotary Club of Calcutta, Vienna for spreading the message to keep people healthy. Namaskar. Thank you.